Hi. Yeah, to set this up, coming up Sunday and Monday, Valley Senior Living, Maple Memory Care staff and residents all getting tested there. There's another 1,000 tests along with the over 700 we had yesterday. I guess for Ms. Swanson and Dr. Weiser, a couple part thing. Do you think that'll give us a lot clearer number of what's going on in the community with nearly 2,000 more of those tests in? And also, are you aware of any other hotspots in the county?
Deb Swanson?
To answer your last question, I'm not aware of other hot spots, but definitely by doing more testing, it will give us a better picture of the possibility of asymptomatic people carrying the virus. And I think it will also help us make sure that we contain any spread of the disease in those populations that are most vulnerable, which is why our state is making a concerted effort to try to test in long-term care in other congregate settings.
Thank you, Deb. Question from Dave Kolpak from the Associated Press.
Yes, can you hear me?
Yes, we hear you fine, Dave.
Yeah, this is for the mayor and/or Debbie. There's been a suggestion in the last couple of days, some stories written that perhaps the protocols have changed in terms of inspections and investigations into some of these companies, in particular in reference to LM. I mean, is that true? Did they do things differently once upon a time?
Well, I do know that when we received the employees concerned March 22nd, that our role was to educate and communicate to them that the CDC guidelines and recommendations were in place, and then they assured us they did follow up with that. But as things have evolved, as we learn more about this pandemic and responding to this pandemic, there are things evolving and coming in place. But at that time, the mayor or the city had no mechanism to inspect or enforce anything like that. So with communication, we were relying on communication to upper management to make sure that they complied. They said they complied. So yes, things are evolving as this pandemic continues.